We turn now to the Clinton Health Access Initiative and the Murdoch Children's Research Institute. We've certainly learned, in many cases far too intimately last year, how critical oxygen therapy can be to our health. But there are places in the world in which oxygen therapy simply isn't available. 90% of remote hospitals do not have a pulse oximeter. That's the device that a lot of us bought at the start of the pandemic to measure our oxygen levels at home. The Clinton Health Access Initiative and the Murdoch Children's Research Institute's project is focused on trying to close the oxygen gap, which would save countless of lives.
More than 46 million patients require oxygen every year, from newborns struggling to breathe in neonatal units to adults fighting COVID-19 in ICUs, or patients undergoing even simple surgeries. The need for medical oxygen also reaches beyond hospitals, in ambulances, rural health centers, and all across the healthcare system. But health facilities often don't have the equipment they need to diagnose and treat patients. As a result, only 20% of hypoxemic patients are diagnosed, and less than half receive oxygen. Our approach was built while working to increase access to oxygen for childhood pneumonia through pilot programs in India, Ethiopia, Kenya, Nigeria, and Uganda. We help governments and their suppliers build partnerships that provide reliable, affordable oxygen to health facilities. We support doctors and nurses with clear clinical guidelines and training. We support governments to develop financing mechanisms to fund operating costs. And we build data systems to measure progress and target investments to where they are needed most. Together, these four components can close the oxygen access gap and build a system that will sustain itself and last far beyond our support. Together, we can close the oxygen access gap for good.
Thank you very much for that important work. Now we'd like to talk about something that I know is, I don't mind saying, very close to my heart, with a project that's aimed at trying to uphold the health of democracy by providing accurate information and rebuilding social trust by using local news. Report for America is trying to put reporters into news deserts to expand coverage in areas of America where basic information about critical issues facing communities just isn't available. They view journalism as a public service and one that's necessary to try to begin to heal this country.
Local news is collapsing. Communities are becoming news deserts, and in the absence of trusted local news sources, people are flooded with misinformation. Even before COVID-19, the number of reporters had declined 60% since 2000. A decline in local press leads to more polarization. We view each other as political stereotypes instead of neighbors with potentially common interests. Report for America is a national service program that places talented emerging journalists into local newsrooms to report on undercovered communities and topics like education, criminal justice, public health, racial equity, and local government. Report for America does not build new news organizations, but rather we tap into existing newsrooms nationwide. We leverage a unique 3-to-1 funding match model, promoting new ways to encourage shared investment in local journalism. We will place over 2,500 talented emerging journalists in over 750 local newsrooms nationwide. We'll field about 1,000 journalists of color in America's newsrooms in 6 years and advance other forms of diversity, creating a seismic shift in representation in newsrooms. The core members will lead thousands of service projects with high school and middle school students. If local residents view journalism as an essential civic good, we can improve local reporting through local philanthropy. Report for America will help restore local news, leaving a permanent impact for generations to come.
And now from the Clinton Health Access Initiative and Murdoch's Children Research Institute, Dr. Mafu Ramatlapang and Audrey Batu. And from Report for America, Charlie Sennett and Allison Bethel McKenzie. Thank you all very much. Allison, I have you in the first box, so I'm going to begin with you. I'll bet this last year has reminded us how important news is, isn't it?
Oh my God, yes. This past year has been tremendous for us as a nation. It has been monumental for journalists. And we are very happy at Report for America. We've been able to put 300 new emerging journalists in local communities where they can report on COVID, where to get a vaccine, what's open, what's not, the rules and regulations surrounding going back to school. So there have been a lot, racial unrest, a lot.
Yeah. And Dr. Ramatlapang, let me turn to you, if I may. Why hasn't the lack of oxygen in all ways, I suppose we must say, gotten the kind of attention it has until we really needed it now?
Thank you for that question. Indeed, lack of oxygen has not received enough attention from the rest of the world because we as health providers, as clinicians, we tend to focus on diseases. A person dies from a particular disease. So we aggregate diseases and we never talk of hypoxia. So this is why oxygen, which cuts across the entire range of diseases, is never really seen as a major problem. What was most surprising to us as we embarked on this process is that in the Western world, oxygen is taken for granted. But we have always known in the developing world that lack of oxygen is a problem. And our worst nightmare happened when COVID hit us, because we knew we did not have systems in place to cope with it. As a result, we, of the Clinton Health Access Initiative and Murdoch Children's Institute, we did not sit back. In fact, we dug deep. We worked very hard to try and assist all the communities, all the governments that we work with. So oxygen by itself, only now are people beginning to understand that oxygen is a major issue.
Thank you, Dr. Ramatlapang. Charlie Sennett, this is changing directions, of course. Mercy, the old school newsroom culture, sometimes made for great stage plays, like my, I think a lot of us in news business, our personal favorite is in fact the Charles MacArthur Ben Hecht play, The Front Page. It wasn't exactly an inclusive culture, was it? And I wonder how you're trying to change that too.
Thanks, Scott. I mean, I know that you and I both love this business. This is what we do. And, National Public Radio has done it so well for so long. And I've been lucky to work in newsrooms where many journalists work hard. Allison and I were together at the Boston Globe. And that was an old school newsroom. That is a newsroom that continues to do great work, but it definitely did not cover the city of Boston as well as it should have. I mean, if you're ever going to look at a story of a newspaper that really tries hard, that does amazing work, but that faced challenges, as you point out, where it wasn't equitable, we weren't doing a good job. And I think we lost the trust of a lot of communities as a result of that. So the chance we have with Report for America is to think about how can we be part of reconstructing local news? How can we be part of systems change to really give it a new life? And we're seeing that we're having impact doing that. As Allison pointed out and Steve Waldman in the video, we've added 300 reporters into 200 newsrooms, and 42% of those journalists are reporters of color. So that's twice the average of newsrooms. That means the average newsroom is not doing well enough, and we're barely on par reflecting the communities we cover, but at least we're trying to change the landscape. More than 2/3 of our reporters are also women. So we're changing who tells the story, but we're also changing how the story gets told and whose story gets told. So our beats go into undercovered communities. They go into regions that have been overlooked or are distressed. So I think we're part of a solution of building on the great work of traditional journalism, but taking it into a new direction and really shoring up and reconstructing local news. Because without it, we are not going to have the country we want. And we saw a horrifying glimpse of that this year on January 6th. When you watch local news erode, in those news deserts comes toxic disinformation and misinformation. And we know now, really frighteningly, that can lead to a crisis in our democracy. And that can really expose how fragile democracy is. So yes, the newsroom lore of old is fun to watch in a movie, but there's a lot of work to do if we're going to have local journalism that will really serve communities, and we're part of that solution.
Audrey Batu, let me turn to you and your particular area of involvement right now. And I wonder what you have been able to learn and what clues going forward we can take from previous global health crises that we inevitably think of HIV/AIDS, certainly in low-income communities.
Yeah, so we've made tremendous progress, I think, in HIV treatment in the past couple of decades, and we've had this progress by ensuring that treatment is effective, it's scalable, it's sustainable, and it's available as widely as possible. And I think that the HIV epidemic really, a lot of people said that it couldn't be solved, it couldn't be fixed, and I think that's a lot of what we hear right now about oxygen access, that it's too big of a problem. But I think our experience in HIV has shown us that it is possible. Right now, there's 21 million people on treatment in low and middle income countries. Treatment costs $65 a year in those countries when it used to cost thousands. And so HIV, we had an opportunity to change the future for that. And we believe that this is the time for oxygen access, that we have an opportunity now to make treatment affordable, effective, and possible across the world.
Alison Bethel McKenzie, let me turn to you on the question of news deserts and trying to fill them with information. Have we learned once again over this past year, and I'm holding this up, so actually that's a picture of my daughters and our dog, but in any event, social media platforms, they're not a replacement for news, are they?
Oh, no, not at all. We have to remember that journalists not only write and broadcast, write for newspapers, online, nonprofit news portals, and broadcast television and radio, but they also share news on social media. And we have learned that there's a lot of disinformation and misinformation on social media. And we count on people we know who cover communities in which we live to give us right and correct information. For example, we have a reporter, Leah Willingham in Mississippi, who covered a small town called Itabena. Itabena's electricity for the entire town was being disconnected because the town was so far behind on paying the electricity bill. This is in the middle of COVID. It wasn't until she went door to door, talking to neighbors, talking to the energy company about why they were going to disconnect it, that we saw a change and the lights were kept on. So we know that journalists can make a difference in what they write and can provide truthful and honest information. And that's what our reporters do on a daily basis. We have hundreds and even thousands, I would say, stories that are very similar to Itabena, where reporters are making a difference and dispelling information that is not true.
Well, thank you very much. Very good to speak with all of you. Clinton Health Access Initiative at the Murdoch Children's Research Institute and Report for America. Good luck to you and everyone who's competing today.